Hi, I'm Annalisa Szymanski from the University of Notre Dame. This paper is titled Limitations of the LLM-as-a-Judge Approach for Evaluating LLM Outputs in Expert Knowledge Tasks. Evaluating LLM outputs for complex tasks in fields such as healthcare, mental health, and law is challenging, as traditional metrics fail to capture the domain-specific complexities needed for accurate evaluation. Human evaluators can be essential in the process because they provide the judgment needed to assess LLM outputs. However, they can be costly. Using LLM as evaluators has gained traction as a more affordable and reproducible alternative to human evaluation. Yet a key challenge remains: how to assess LLM performance in domain-specific high-stake tasks, and when to rely on a subject matter expert, referred to as a SME, versus LLM-based assessments. We focus on two key research questions. First, how does the LLM-as-a-Judge evaluation approach compare to the evaluations conducted by SMEs for domain-specific tasks? And second, what are the main factors contributing to the evaluation differences between LLMs and SMEs? We conducted a case study in two complex fields of mental health and dietetics, both requiring expert knowledge. Using a mixed methods approach, we ran a pairwise comparison study with SMEs who were licensed professionals such as registered dietitians and clinical psychologists. Both SMEs and LLMs evaluated domain-specific tasks and provided explanations for their choices. For each domain, we curated a data set of 25 instructions each. SMEs and the large language model evaluate the instruction outputs with the general preference question: which response is better overall? Along with two specific aspect questions for each instruction to assess dimensions such as accuracy, clarity, professional standards, and more. We use the Alpaca Eval, which is a standard evaluation framework to identify the preferred response from the large language model. Both LLM and SME evaluations were recorded on the same data, and we calculated percentage agreement. To further assess match rates with a human expert, we compared the LLM as a judge with and without an expert persona. SMEs had a low agreement rate with the LLM, with 64% in dietetics and 60% in mental health. Using the expert persona method improved agreement by 4% for both domains. There was also a significant variation in agreement across aspect questions, with high agreement on professional standards and dietetics and accuracy in mental health. Additionally, there was variation in agreement when using the expert persona. For example, the expert persona increased the agreement rate for clarity in dietetics, while the opposite was observed in the mental health domain. In addition, we were interested to see how lay users would align with LLM preferences, given their use in RLHF fine-tuning. We tested whether there was a difference between lay users' agreement with LLMs and SMEs' agreement with LLMs. We found an 80% agreement rate between the LLM and the lay users in both dietetics and mental health, suggesting a closer alignment with lay preferences. A chi-squared test shows a significant difference between lay users and SMEs in agreement with the LLM. Interestingly, using expert personas decreased agreement to 76% in both domains, relative to the SMEs where expert personas improved agreement. To guide researchers and developers in evaluating systems for domain-specific tasks, we suggest design implications. First, SMEs should be incorporated in the loop for complex evaluations to provide critical insights and help identify errors and misalignments that automated systems as well as lay users often miss. Second, a one-size-fits-all evaluation approach may overlook critical domain-specific weaknesses. When designing evaluations for systems that operate across multiple domains, each domain should have a tailored evaluation framework similar to the one used in our study. And third, LLM expert personas should be tailored to domain-specific expertise for improved alignment due to the variation observed in this study. Thank you.